If you want to do this, cool. Like, it's your body, it's your choice. And I've not had a single person get mad about getting on TRT. They're always like, oh my God, I should have listened to you 4 years ago. And I'm like, I know.
Yeah.
Firstly, I think most men are not just trying to have a higher testosterone level on paper. That's not the goal. The goal typically is to feel more masculine.
Now, the problem with the parameters that we have started with was they got a settled group of people, 100 people, and they said, we're going to get blood tests. Oh, the smallest quantity was 1. The highest quantity is 100. I'm going to get a bell shape and I'm going to say this is normal. People are not labs. People are not averages. You cannot base a freaking lab and say, oh yeah, you're normal.
Who is TRT for? Testosterone replacement therapy should be for anybody who medically requires it. Straight up. Just like we would give insulin to a diabetic who medically requires it, why would we withhold something so valuable from men who need it?
In my opinion, like, sure, go get some sunlight, do all these other things, but like, I really, no pun intended, want to move the needle. Yeah. So when do I pull those levers for a client? Or sorry, maybe not for a client, but like, again, a client maybe comes to me and they want to pull those levers. How do I know when it's okay to do so?
To pull like the TRT lever?
Yeah, that's really the big one, right?
And refer them to somebody?
Yeah.
I try to get everybody to, if they will. But I also, I always tell guys, look, it's, I've done TRT, I'm on TRT, I've done steroids, obviously. Like, I've always been transparent about that. I mean, you're not, at one point I was 270 pounds and I was like 17% body fat and I was deadlifting like 730 and squatting 700.
Let's bring that guy back.
You don't know. I'm too old for that now. That was 20 years ago. That's like, so I'm a big fan, and I'm a big fan of like personal responsibility, ownership, and YOLO. Like, if you want to do this shit, cool. Like, it's your body, it's your choice, right? We always say that about women and abortions and stuff, but men should have that option too. It's my body, my choice. If I want to jack myself full of trend and I don't hurt anybody, then except myself, fuck it. But I'm also a proponent of like less is always more. So if guys come to me and they go, hey, do you think I should get on? Like, a lot of my guys are in their mid 30s, 40s, 50s. And yeah, they're working 80, 90 hours a week. Same type of client that these physicians would have, except mine are coaches. So they might have a staff of 10 or 13 people. They're sleeping 5 hours a night. I already know your testosterone is going to be low. Let's just go get it tested. And if it is, like, go to a private lab. And then if it is, then we'll find a physician for you, through Silverback. Or Dave is a good advocate for me in Australia. I've sent a lot of clients to Primal. And then some of the guys in the UK, Ross, those guys sent people to them as well. But I think every guy these days in their 30s should at least go get their panel done, because I think they're going to be real fucking surprised. Like, I've been on TRT since 36, and I don't know, mine wouldn't have been lifestyle in the way that a sedentary population. Mine would have been lifestyle as I was a former competitor in strongman and powerlifting and bodybuilding. And there's only so many times you can push your body to those extremes before shit doesn't want to come back on. And so, I'm a big proponent of that, especially if you get guys who they're doing everything right, and they're just so slow of their results. It's like, all right, let's just go get comprehensive labs and just see if there's some type of problem where we can get some external help from a physician, and everything's going to be way better. And I've not had a single person get mad about getting on TRT. They're always like, oh my God, I should have listened to you 4 years ago. And I'm like, I know.
Yeah. No, I've heard the stories where like, yeah, I just want to try it out, blah, blah, blah. I'm like, dude, as soon as you turn that lever, like, you're going to be so happy that you're going to be upset that you didn't do it sooner.
I have a client. He actually works for me. He's in his mid 50s. And I've told him like for years, I'm like, you're just like, you have such a hard time. You're like a little frail ectomorphic dude. He looks phenomenal, shredded, but he just can't put on muscle. Like, you just need to go, let's just get your hormone panel. So he goes, and everything on his labs looks good. I'm like, yeah, but looking good on your labs, that may not be good for you. You might have been way higher than that when you were younger. So we've got to find someone who doesn't just look at the numbers, but also looks at your symptoms. Got them all hooked up. He's put on, oh my God. He was like, do I have to take it forever? I'm like, you don't have to, but you're going to want to.
Right.
Because once you get on it, like, there's no going back. There's no going back.
Yeah. And that's funny because, like, I always mention, like, I wish I got my labs done when I was like 18, like, just to see, like, okay, well, where did I start? And then again, like, every like 5 or so years after that, because you're right, my labs today might come back at 450 or something, but they were, at 1,000. I don't know.
Yeah,
And then somebody's going to say like, well, 450, you're doing fine or whatever. When it comes to interpretation, why does it seem like anybody can look at labs, but not anybody can give you a legit answer on whether or not, like, hey, you should probably explore these other things?
Yeah. Well, the thing is, you have to take labs for what they are. They're not a measurement of optimal levels. They're a measurement of sick people. When's the last time you went to the doctor and said, hey, I feel great, can we run some labs?
Of course, yeah. Yeah.
Sick people go to the doctor. So it's in those, every lab has different values. They're somewhat different based on their averages of what they've seen, and then the government will change guidelines at some points. But like, I was lucky that I did get labs done when I was younger, and I was way above the high level even before I ever took anything. Mm-hmm. So like, when I go to the doctor and he sees that mine's like a 368 and he's like, well, that's pretty low. It's not under 345. I'm like, yeah, but mine was like 1400 when I was at 20 and I hadn't touched a thing. It was like, wow. But the government tells them what they can and can't do. Mm-hmm. But if they work on symptoms too, now they have another lever. They can go, well, you can't get an erection. You're not interested in sex. You're losing muscle. Okay, this is a bad thing. So now I can actually justify that this may not be the right level for you. So let's put you on stuff.
I guess, what was the driving factor in making you kind of tell other people like, hey, this is why testosterone is so freaking important?
Yeah, that's a very good question. There's a couple of things that tie into that. So I was originally very interested in psychiatry, particularly in why so many people just weren't doing well. Low-grade depression, low-grade anxiety. There were a lot of treatments and protocols and recommendations based on major psychiatric illness, but not a lot of the stuff that was impacting so many people day to day who maybe, didn't want to self-delete, but didn't want to get out of bed in the morning. So when I had my brain injury when I was in my mid-20s, it really caught me off guard. And one of the challenges that I realized in hindsight, looking back on it, was that I hadn't really been through anything difficult in my life before that had given me the skill and the resilience to be able to push through and overcome adversity. So it wasn't until I started testosterone treatment that I felt my mindset shift more towards, I want to take a swing at this and actually see if I can come back from this and recover. And I was very fortunate that I was able to, but it took so much more grit and determination that I even really thought I was capable of. And in the recent years since, anxiety and stress, which is what I'm speaking about on the main day, is one of, if not the most prevalent issues that men are complaining about. And I think Jordan Peterson puts it best where he says, competence creates confidence. And this is one of the biggest struggles, is that when a man is going through his formative years, like I very strongly disagree that a man is an adult at 18. You can legally access some stuff, but your brain doesn't finish developing until you're 25. I think we become adults at 30. And I think the big challenge coming up for these younger guys is that they're at a point in their life where they haven't formed their identity. They haven't really mastered a skill. They haven't mastered themselves, but they're in a situation where their androgen levels are also that of a much older man. And I think this creates a lot of problems because it typically takes multiple decades for a man to be confident and resilient and able to express the best version of himself in life. And if everything's going well hormonally, that point that a man reaches that will be right when his testosterone level starts to drop off. So as he gets older and he settles into, taking it easy and kicking back, this is not the end of the world. But when someone's coming up with low testosterone when it's supposed to be higher and they're supposed to be making their mark in the world and be, capable of overcoming risks and adversity and really being able to push forward, I think I know because I've seen it, it's very detrimental in terms of the trajectory of where they end up. Because if you don't have that drive and resilience and motivation and just the capacity to be able to take a swing at things, it's going to drastically impact the choices that you make, the path that you end up on, and the decisions that ultimately lead to you living a depressing life. Mm-hmm. And I think that that's something that is drastically overlooked. And that's why I like to say that, TRT takes time to work, but it also takes time to do the work. So yeah, that's what I've seen a lot of working with younger men. And that's why I get up on stage and teach these things, because these guys need to know that they're not alone. They're not defective. It's not because they're failures. It's because their machinery has not been functioning the way that it should to be able to fulfill the role that they need to fulfill in society.
And it seems like they're like young men are being attacked from multiple different angles, right? Like we can talk about the environmental things in regards to like their testosterone levels, which we should definitely get into that. But also it seems like men aren't being held responsible to be adults until significantly later now. Right, looking at like my parents' generation, like they were married at like 18 and living in their own like house by themselves, like by 20. Right, fast forward to today, and we got 40-year-olds that are still living at home. Right, so what is that doing to their confidence and potentially their testosterone levels as well? But again, when you look at all these factors, it seems like again the environmental things crushing the testosterone levels, but then also like I guess as a society, we're not expecting enough of men. And it's like, again, like I said, it's a really tough spot to put young men in. So with all that in mind, what are some things that men can do, right, especially early on, to start to get some of that momentum and start to build some of that confidence?
Yeah, that's a very good question. And I like the actionable stuff, because it's all well and good to present philosophy and present these different rationales and perspectives on things, but if people don't have an executable strategy on what to actually do, it doesn't really mean much. So the one thing that I think is important is that if you are you and I am me, we are alone with our thoughts 24/7. We know if we are putting on a facade. We know if we keep our word to ourselves. We know if we're hitting snooze. We know if we're eating cheat meals when we shouldn't. All of these things, I think, can really weigh on people's conscience. It can be very difficult to lay your head down at night and go to sleep if you haven't achieved everything that you set out to achieve that day. And I think that's one of the most common causes of anxiety and insomnia is people are very self-critical, but they're self-critical because they know that they are objectively not living up to who they could be. The problem is that if the machinery is broken and defective, it's kind of like you're trying to be a race car driver in a faulty vehicle. And I think that can be very psychologically damaging over time because you're not developing the self-esteem because you don't have that proof of success, that proof of actually being able to do what you want to do and what you want to achieve. So I think there are some good strategies to look at. I think firstly, people should really focus on mastering something. If someone is a welder or if someone's an electrician, if you are a phenomenal welder or electrician, if you walk into a room that has nothing to do with your trade, you're still going to exude and have more confidence because you know that as an individual, you have mastery of some area of skill that is valuable to society. So I think people should really focus on not trying to start multiple different things and be a jack of all trades, master of none, is find something that you like or something that allows you to earn a living that you don't hate and get really fucking good at it. Like I can imagine that you doing what you do because you have the knowledge and the proof that you are an expert in your field, that confidence translates to when you're ordering at a restaurant or when you're going into a social interaction because you have been able to move forward and succeed in a field that previously you were one day a beginner at, you didn't know anything about. So I think that's very important. The other thing that I really like that I basically prescribe as a health coach is I like people to practice mindfulness and I like people to practice martial arts. And this combination of experiential therapy, I think, is very valuable. And I don't recommend people get into sparring and actually fighting because I work with brain injuries. That's not a good idea. But simulating violence with pad work and having a male mentor to take you outside your comfort zone. If you wake up in the morning and you get overwhelmed by opening your email inbox on a Monday morning and having a messy room and needing to do the basics, if that pushes your stress capacity, it's not because that's too hard, it's because you're too soft. And going and doing some form of martial arts, again, just pad work or just basic drills, once or twice a week gives you something that is far more acutely stressful than anything else you're doing, which reprograms your sensitivity to stress. It basically gives you better stress tolerance because by association, all of those things are not stressful at all. They just require putting one foot in front of the other. And then when you're looking at mindfulness, you're basically learning to focus your attention on what you want to focus it on, which ultimately gives you the ability to do what you need to do and not what you want to do. And if you're able to do what you need to do, not what you want to do for a prolonged period of time, this ultimately gives you the foundation to actually be disciplined. And if you lack the skill to actually have discipline in the first place, not only is your life going to become a chaotic mess as your responsibility goes up as you get older, but you're also going to feel very inadequate. You're going to feel like a failure because you're saying, I can't even do the basic things I need to do. And if you can have that balance of increasing your stress threshold and improving your ability to focus and take action on tasks, I think that leads to good outcomes.
Very well said. That was fucking great, P. You crushed that. Sorry, I had to kind of get out of the interview for a second there. But speaking on more tangible things, everybody watching, everybody here, we all kind of already understand that, like, especially here in America, the testosterone ranges are so broad that you could feel like shit. You can have terrible testosterone, but still be within range and not get that prescribed. We all kind of already know that. Now, for somebody that did get that prescription, right, we kind of already know what that prescription is going to look like. It's going to look like 200 milligrams, 3 shots per week. If stuff starts to get a little funny, maybe some DHEA. If they're not at a good clinic, some anastrozole, right? Like, we kind of already know that. But what if I'm taking, we'll say 200? Allegedly, this is not medical advice. Don't do anything that we're about to say. I'm still feeling like shit, man. But I'm doing the thing that's supposed to make me feel good. Where do you think people that are getting, people that are prescribing, where they're missing the mark when it comes to, like, well, he was at 200 nanograms per deciliter. We got him on 200 milligrams, and now he's at 1,200. I did my job. Maybe he's just not working out hard enough. Maybe he's not getting enough sleep because I got his levels up. He should be fine, but that person still feels like shit. What is that prescribing doctor missing?
The problem is that they're looking at a very complex series of interconnected systems through a myopic lens. So testosterone is not the only thing that impacts how you feel and how you perform. It is a piece of the puzzle. And the problem is that it is difficult and it requires a very in-depth, intrinsic understanding of human biology, which I think a lot of practitioners put in the too hard bucket. You know, they get paid either way. They want to do the easiest job. They want to get home and they want to basically, call it a day. And I get that. People are people. But if people are wanting to actually deliver the outcomes for their patients that makes them subjectively feel better, but also are objectively healthier, they have to look at every series of systems in the body, but not just individually, but how they're interconnected, kind of like the engine of a car. So practitioners have to be doing comprehensive blood evaluations to test all systems in the body, all hormone markers, all comprehensive panels, and then they have to cross-reference this with the patient's lifestyle, the patient's psychology, the patient's goals, and basically see, is there another biological parameter going on here that needs to be diagnosed, treated, and resolved? If that's not, and everything is smooth sailing, it can often be a psychological issue. And testosterone gives a man the foundation to repair his psychology, but it doesn't rebuild the psychology for him. If a man brings his testosterone levels up to, double the top of the reference range, it's not instantly going to give him courage and bravery and determination and stress resilience and all of these things. It's going to give him the capacity that if he does the activities to build those traits and values, they will respond properly. If he rebuilds the house, now that the foundation is set, the house will stay up and stand tall, but he actually has to go through and do that work. And if he doesn't do that and is still expecting the results, it can be a misalignment of expectations if he's not actually understanding that and he's not taught that, which the practitioner has a responsibility to educate on. And if he knows that and he's still expecting to get those results either way, then that's an entitlement mentality, which never works out either.
Mm-hmm. What are some of the actual measurables that we can track, right? Because, okay, we see that the testosterone level is double the reference range. He still doesn't feel good. Are there any other measurables that we can track to whether it be prescribed something different, or maybe it's a blood marker that we can focus on, like, hey, when this is high and this is low, or whatever, like when this is out of whack, that means X, Y, Z, and we can approach it this way. Like, are there other measurables?
Absolutely, yeah. And a lot of the time it's the combination of different blood values as well. So if I had to put it in a rough, this isn't prepared, so I don't quote it in exact order, but if I put it in a rough order of prevalence, insulin resistance is a big one. So, if fasting insulin and HbA1c are elevated, the patient has metabolic syndrome, which means that their body is not efficiently burning energy, which means that if you don't have enough X to do Y, this is the definition of stress. So if you're biologically stressed, you're not going to be performing mentally or physically well. The other ones to look at is liver disease. So if a patient is drinking alcohol or high volumes of alcohol in particular, they can develop something called non-alcoholic or alcoholic fatty liver disease, in this case, the former being from insulin resistance. And this can mess with the body's ability to detoxify, the body's ability to metabolize hormones properly. This is something that needs to be fixed and resolved. Hypothyroidism is also overlooked and undiagnosed. Deficiencies in pregnenolone and DHEA, they're less common, but they are more common in men who are older and in some younger men as well. All of these things are probably the most common markers that I see. And then you can also get issues with like combined elevation of cortisol and prolactin, signifying chronic stress. There may be physical injuries in the body. If the patient's always in pain, they're going to be making, absorbing, and clearing dopamine out faster, meaning they're not going to be feeling mentally as well. All of these things are part of how the individual is a complex series of interconnected systems, but they're also sentient, they're also conscious, they're a human, they've got thoughts and behaviors and values and attitudes. So it's difficult for a practitioner to say which of all of these symptoms are coming from the androgens themselves, and if the androgen deficiency is resolved and there's been enough time for what's called the DNA transcription effects, meaning the long-term recalibration effects from the testosterone, if that's been in place for long enough to take effect, it means that it defaults to the fact there's another issue. And I think it's easier from a systemic approach to go through and eliminate biological and lifestyle issues as well. Some people are eating like garbage, drinking alcohol, working shift work. They're doing a whole bunch of small problematic things that add up to a situation where it's like, well, you're not living optimally, so you're not going to feel optimal. If your cumulative lifestyle habits are a 6 out of 10, you can't feel like a 10 out of 10. It's not going to happen. It doesn't matter what you inject or what you take. It's not actually possible to thrive mentally if your body is physically sick. So all of these things together are things that people need to be looking at and considering.
Mm-hmm. So I don't want to spend too much time on it because, again, I feel like with this audience, everybody kind of already has a good idea on how to move that testosterone level from where it's at to a little bit higher. So if you can just do a quick breakdown on that, but then also, like, what is the actual goal? Right, because we have a lot of supplements that guarantee a lot of testosterone boosts, right? Like Fedosia agrestis got really popular. Tonga Ali got really popular because you could take it and your testosterone is now higher. Do we even care? Like, why do we even want that? Like, I know, right? I know why we want that. We want higher testosterone because we want to build muscle. We want energy. We want all these things. But is taking something like that even worth it when you stop taking it and it's like kind of gone forever? So if you could quickly, again, talk about like some of the bigger movers for like raising the levels naturally. Because again, I think we already know, but I want to hear your take on it as fast as possible. And then what is the true goal? Like, right, is it just I want a higher testosterone level because that's where things like get funner? Like what is the actual goal though?
Mm-hmm. I'll answer the question backwards. So
okay.
the goal is, if we look at what testosterone, firstly, I think most men who want to go on TRT are not just trying to have a higher testosterone level on paper. That's not the goal. The goal typically is to feel more masculine. And then we have to ask the question, well, what is masculinity? What does that actually mean? To me, masculinity is the capacity and the execution of leadership. If we ask what is an alpha male, alpha means leader. The alpha of the pack is the leader. So then we go, well, what is leadership? Leadership is the ability to be resilient under stress and to lead. And when we look at what testosterone does biologically, this makes a lot of sense to me because it is an antagonist to a lot of the stress signaling in the brain and the body. It's anti-catabolic, meaning it prevents breakdown of muscle tissue as well as bone mineral density and organ systems. But it's also something that facilitates the proper neurotransmission of not just dopamine, which is motivation, pleasure, passion, drive, but it also facilitates the proper GABA signaling, which is the target neurotransmitter of things like Valium, Xanax, alcohol, sedatives, things like that. So I like to use the analogy of the Jaeger bomb. Everyone knows what a Jaeger bomb is, right? So and people shouldn't drink Jaeger bombs, but the reason why people do is that if you're out partying, you've got the caffeine and the sugar, and then you've got the alcohol. And together what that's doing is it's basically making you more driven and energized and, feeling kind of buzzed, but it's also acting as a social lubricant to be more calm, less anxious, and people like the feeling of this. Testosterone doesn't feel like a Jaeger bomb, but mechanistically, when we look at the combination of how testosterone and DHT works on neurotransmitters, by facilitating dopamine and GABA activity, this allows a man to be more motivated, driven, and passionate to push outside his comfort zone, but also being cool, calm, and collected under stress. That is the recipe for leadership. So if we look at what can men do to actually support this, and I just got back from Melbourne giving a lecture on this exact point, is you basically have to do all the things that you should be doing and stop doing all the things you shouldn't be doing. And that can be a difficult pill to swallow. I mean, I used to be a musician. I used to be a singer. I used to like, drinking alcohol and going on stage and punk rock. And I feel like a hypocrite to my 18-year-old self for telling people to not do all of those fun things. But if you are wanting to be an optimal, thriving human organism, you have to understand that the body's priority is survival first and reproduction last. So if the body is sick, stressed, or not nourished with the nutrients it needs, it will ultimately divert resources, meaning hormones and precursors, away from reproduction and towards survival. So less production of androgens towards more production of stress hormones. So what we have to do to bring the body into alignment is to basically support the body to thrive the way that it is set up to thrive. So this is providing an abundance of healthy, high-quality nutrition. If needed, the supplements people should use rather than things like Fedosia agrestis are the things I talked about in my talk, such as a comprehensive multivitamin, things like a good quality magnesium in a sufficient dose, vitamin D combined with actual sunlight as well, which is very important, and omega-3s to reduce inflammation and stress. These things can be very helpful. And then the other thing that we have to do, which people really don't like, but it is the fact of the matter, is that we need men to ideally be sub 15% body fat. And in Australia, we have a very strong, abs for the beach culture, abs are for health. Abs 24/7 is what is required, because when we have higher levels of body fat, this is not only increasing the conversion of testosterone to estrogen, but it's also reducing the feedback in the hypothalamus in the brain to make more testosterone internally as well. So men have to be lean, they have to eat a healthy diet, they have to sleep well, they have to get enough time outside, they have to do enough physical exercise. And if their body has the capacity and is not physically damaged from endocrine disruption or age or injuries or whatever, then their body will thrive in terms of actually producing optimal testosterone. But it's not something that people can biohack, because we are not smarter than the body. There is no workaround for being unhealthy, but having healthy hormone production and levels. And the problem is if guys go, well, I don't want to do all that shit because that sounds boring, I'm just going to inject testosterone and keep partying. The thing that they don't realize is because they're basically now putting a sports car engine into a piece of shit Swift that needs to be serviced, what they don't realize is that because that optimal testosterone level is not supposed to be there, it's not going to metabolize and be absorbed properly. And the gap between the amount of testosterone they're injecting and the amount of testosterone that they should be making based on their lifestyle is side effect territory.
I really want to go down that rabbit hole, right? Because although there is, I believe there's a study where they literally just injected testosterone into sedentary people and they told them to change nothing, and they got a little bit healthier, right? But what you're saying is we can't just live like assholes and we can't eat like shit and we can't do nothing and then throw testosterone on it and act like it's going to fix everything. So what happens when again, when somebody does this, like what actually happens to their body when they ramp up the testosterone, but the habits and everything else that they should have had in line before, those haven't been established yet?
Yeah, that's a great question. So the body is much more complicated than a lot of people give it credit for. And this is where I'm a big fan of studying and understanding human biology and then seeing how these outcomes play out in practice. So when someone injects testosterone, it doesn't do anything until it binds to a receptor. So it's kind of like playing pinball on like a pinball table. You can have as many balls flying around the table as you want, but you don't get any points until it hits the bumpers, right? So hormones are like that. They don't actually do anything until they activate a receptor. What we have in the body is a variety of processes and regulatory mechanisms that change the receptor expression and availability of the androgen receptor, as well as things like estrogen receptors as well. So if someone is in a situation where they are making very little testosterone because their body is actively suppressing the production, not because the endocrine system is damaged, but because they are sick and inflamed and, living like a dickhead. If you take then the healthy amount of testosterone, that has no business being in the body. So the body is not primed from a metabolite enzyme perspective or from a receptor perspective to actually utilize those androgens properly. So what ends up happening is that not only does the hormone not work, but then it increases the conversion to estradiol, and then people also have an upregulated estrogen receptor expression due to inflammation. And a lot of this is driven by insulin resistance, as well as consumption of things like alcohol and other drugs, which can impair the liver's ability to properly metabolize these hormones. So what they end up with is a very different ratio of testosterone to DHT to estrogen due to the way that their body is working. But it's not because they are genetically an over-aromatizer or because something is broken. It's because the body is responding to how they are living. So when the receptors are not available, and when the ratio of metabolites, because one thing that people also don't speak about, which I just spoke about in there, is that when someone is sick and inflamed, not only do they make more aromatase, they make less 5-alpha reductase as well. And DHT, which is the outcome of 5-alpha reductase, is the main androgen that drives what's called androgenic behavior. So we look at the anabolic side, which is muscle building, but the androgenic side is what's masculinizing. So if you have less of the androgenic metabolite and more of the estrogenic metabolite, less of the body's ability to bind and absorb androgens at the receptors, more of an ability of the body to absorb estrogen at the receptors, we now have a very different outcome in a sick man versus a healthy man. And this is what leads to side effects and suboptimal outcomes. The problem is that people try to fix that with taking more drugs. And then now you're working even further against the body because all of these metabolite ratios are your body trying to protect itself. Mm-hmm. So, someone will be like, okay, well, I'll just take some anastrozole and block the estrogen. That'll fix the issue. That won't increase the DHT production, one. But now we're in a situation where that estrogen that's being produced is protective because the body is trying to protect itself. So now people will tend to they'll solve one problem, but they'll create two more. Mm. And the further you throw your body out of alignment, the worse, because you're subjectively inhabiting this body, the worse or kind of suboptimal you're going to feel.
Yeah, it kind of reminds me of like somebody who's broke and has terrible, bad money management skills, wins the lottery, and then what happens, right? They end up blowing all the money and going back to being who they actually were, which I'm assuming is what's going to happen when they ramp up testosterone.
Anybody that goes to their GP, they're going to be within range almost no matter what.
Yes.
Even if they somehow magically get the okay for whether it be testosterone or some kind of HRT, optimization, those levels might look better. They still might not feel good. Why is that, right? If I don't feel good, TRT good, I should feel good. But maybe, I don't know, doc, I'm still, something's a little bit off.
First of all, my office is a little bit different because I would go through your whole history. I make sure that I know who you're married to, where you work, where do you live, where do you sleep. I mean, things that you didn't even think about asking, do you believe in God? Because I can tell that when I ask you that question and the answer is yes, I'm going to have better outcome. So I got to look at everything in life. I just don't look at one thing. Now, the problem with the parameters that we have started with was they got a settled group of people, 100 people, and they said, we're going to get blood tests. Oh, the smallest quantity was 1. The highest quantity is 100. I'm going to get a bell shape, and I'm going to say this is normal. Mm-hmm. People are not labs. People are not averages. People are so different. Skin, sex, race, everything is different. Location, all those things. And you cannot base a freaking lab and say, oh, yeah, you're normal. You can't do that because, and I'm going to give you a great example. I have a person that lives in Ohio, depressed, right? And his vitamin D or her vitamin D are 50, which normal on a blood test is 30 to 100. Would you say, wow, that is absolutely great, mm-hmm. which it is good, except that I'm going to put her on vitamin D. That patient comes back 3 months later, I feel much better. Now, remember that the guidelines for vitamin D are 400 to 600 IUs. We as humans tend to isolate elements or vitamins or minerals by itself. And that's a mistake because we cannot do that. All the vitamins work together. And I'm going to have a couple of slides showing how that happens. For example, some people might have low testosterone, but when you talk to them, they might be a vegetarian, which I hate, by the way. And those people have low B12. Those people have low vitamin D. Those people have low niacin. By the way, niacin is the most important vitamin in the pathway to make testosterone. Now, what happens when you tell a person you need to niacin? We give them a gram and they get froshy. They get the flush.
Okay, yeah.
Remember that?
Yeah.
Well, of course they're going to do that because they're, number one, they're low. All the receptors are open. They are in need of it. So it's going to react to it. But let's start low. Let's start at 200. This is 200 for a week. Then go 200 twice a day. Then 200 3 times a day and see what happens. And it's kind of funny how this adding just one little spark plug within that system makes a big difference on that person. Mm-hmm. I also noticed that not everybody needs the same amount. Some people need more. Some people need less. I also have screwed up with thyroid. I give patient, I am tired. I give him thyroid. Now I'm worse. I'm much worse. So I said, wait a second, what's going on? So then I look at iron levels. I look at all the things that are affecting that person. I didn't correct it. I didn't correct that tire that was flat.
There we go.
Oh my God. So I didn't correct the tire that was flat, right?
Yeah.
So
flat.
Yeah. Flat, flaccid, no good.
I'm going to get you later. But I even forgot what the hell I was going to talk about now.
You're talking about like, okay, so if I get someone on thyroid because they're tired, put them on, and now they feel worse. Why is that?
Actually, in this case, this person was tired not because her thyroid was low. It was because the iron levels were very low. She came with blood tests to me, so I'm basing on what I saw. And her thyroid actually was borderline low. But the problem that I made was, and people do not know this, you require iron to make thyroid. I know you're not aware of that. So to activate thyroid peroxidase, which is the enzyme that allows you to convert the iron and put it into the main molecule, you require iron. With our iron, you cannot make thyroid. I corrected the iron, which corrected the number of the thyroid, and then she felt better. She felt good, and then I put her on thyroid, and then she felt great. But I didn't correct it, that flat tire. I put more air on the tire that was already full, but I didn't correct the tire that was empty. Mm-hmm. That's what we need to look at the body at all, everything. I don't like to think of the body part. I like to think systems.
Mm-hmm. And then, so why do you think some clinicians are not little? They're very hesitant to like pull on some of these levers.
It is because we have to practice the standard of care. Everything is based. My career is based. You have to do the standard of care. So if I put somebody on MP thyroid and they go to another doctor, oh my God, that doesn't work. That's natural. That doesn't do anything. Centro is a drug. And they change the patient. They don't ask how much better they're doing. They got to change because I know practice the standard of care, which is Centro. They can actually take me into the medical board and accuse me of practice under the standard of care. So I'm going to defend doctors now. We also have to protect ourselves because we can get sued anytime. And the board has all the power. I mean, there's no role there that you're proving. No, they have all the power. They don't like you, even you correct, they're going to take it away from you. So that's what sometimes I'll feel bad. And that's why I'm going to explain today why I'm showing them this data. But when I talk to them, I'm going to say, this is not a medical instructions. This is just information for you to take it. But you need to do all these steps before you do what I do. I get amazing results, and I'm going to show, especially with arthritis, I'm going to talk about arthritis, psoriasis, and I'm going to talk about multiple sclerosis. I want to see how you can achieve drug-like effects with supplements.
Got it. So something we were talking about before we started recording, you were talking about how individualized or how everybody's an individual.
Yes.
And everybody essentially with that in mind is going to need individualized
care. Absolutely. But you cannot do that. It's a standard of care. If you have low thyroid, everybody has to have Centroid. Cannot be different. So it's very tough to find true physicians that are truly to not even deviate, but to practice true, real medicine.
This is going to be a really hard question. Well, I mean, you're going to answer it perfectly, but I guess the way I'm going to have a hard time asking this question, because I think the answer is an entire complex panel. But for somebody watching that's on the patient side, they have a general practitioner. What are some labs that they are just super essential that they need to start requesting to figure out what's going on under the hood?
That's a great question. I had never set a standard of labs because I want to base it on what you're there for, because everybody is unique, remember? And I know that's a great question, but I want to have a guideline. So for me, if you're a man or female, I'm going to talk in general. So if I say PSA, because we're doing a man, right? So, but women have PSA, by the way. That's another lie in medicine. So if you have breast cancer and you measure, you can follow the PSA to see how bad it is on a female. If I have a person like just walking, normal adult, not a child, I'm going to get a CBC, okay, with a differential. That means the white blood cells, hemoglobin, everything else. I'm going to get a CMP, which give me in most areas, give me the liver, the kidney. I can see that. I absolutely have to get a GGT, okay, because of all the blood tests, believe it or not, is the biggest marker of death. GGT, above anything.
And what's the GGT?
Gamma glutamyl transferase.
Okay.
It's an enzyme that absolutely serves as a marker for death. Let me put it that way. And it helps you make glutathione on your body. That answers that. I will get a hemoglobin A1C. I will get an insulin because it's the other big marker. I always get a B12 and folate because I cannot get an MTHFR mutation cheap, but B12 and folate give me an idea where you are. Idea. And the levels there are absolutely horrendous, what they think is normal, but that'll be another one. I get a PSA and a % free PSA. Don't ever you as a man, don't get a PSA. It's a bull lie. You need to get a % free PSA. And I have a sample of my lecture here today that I have a guy that can be 0.4% free PSA is really low. Next 3 months, his PSA is 0.8, which is absolutely beautiful. But the % free PSA went down. I did an MRI, he had cancer. Got it? But in the other hand, I got that the PSA was 18, but the % free PSA 32. I do an MRI, totally normal, prostatitis, right? Or inflammation on the prostate, which is crazy. So that's why everybody, like I explained to you, is different. Everybody gets a vitamin D, everybody gets a TSH, everybody gets a free T3, free T4. Now, depending where the stage or age of the person, I might get LH, FSH, I might get estrogen, progesterone, total free testosterone. Those are basically markers that I would actually get.
Got it.
If I have I see a lot of infertility in the office, so I will get AMH because I have to get that.
So in regards to vitamin D, specifically vitamin D, because we can talk about natural ways of raising testosterone and that sort of thing. Assuming you filled the tire and you got all the other things in line.
Correct, yeah.
Does it matter if I go outside to get it versus getting it through a supplement?
That is absolutely one of the best questions I ever had. When you go outside, you have to go at a certain time to really get the maximum amount. it has to be between 12 p.m. and 2 p.m., which we are either eating lunch or we're at work. So yes, you can go outside and you're going to tell me, I'm going to spend the whole time under the sun. Most people don't go outside and spend the whole time on the sun between 12 and 2. You got to go to work. Can you get all the vitamin D and that's your question, can you get all the vitamin D to be able to be normal? Yes, you can, up to a point. If you have the best indicator of what you need is called disease state. What kind of disease you have? How do you feel? That's going to give me a guideline. If you are saying, I'm going to get the sunlight and I'm going to measure my levels and they're normal, those levels that you consider normal are not normal. You might need 2 hours now, 2 hours later, Also depends on your skin color. Black, Puerto Ricans, brown skinned people like you and I, we cannot be there. We have to be there for 2 or 3 hours because our skin protects us against the sun. So you see what I'm saying? Yep. You have to be very careful.
It's very nuanced. There's very individualized. So again, cookie cutter clinics, like, get out of here.
I just can't wait until you see the lecture because I know you're going to come with more questions because I'm going to, for example, normal glucose. They say it is from this to this, right? If it's above 120, you have diabetes, blah, 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 right? And the normal levels on a blood test are 70 to 100, right? I'm going to prove to you, you can what? You can see it, that is a lie. And when I show you, I don't know if you have family that are diabetics, or I don't know if you have family. Okay, they said that normal is, you're in the 200s, you're normal, right? Because you're diabetic. That's baloney. That's a lie. And I'm going to prove it to you inside. But also, what's the lowest sugar that you ever seen?
No, I mean, I couldn't even tell you.
Most people say, 50 is really low, or 60, the machine will go beep, 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 beep. Right?
Okay.
Well, you're going to be surprised when I show you what normal is on a patient.
I mean, okay. So obviously you're not here, so you're going to miss out on that. So that's it. Like, you're not going to get any preview of that. So we're going to have to move forward. Let's fast forward to that clinician. They're the ones that are getting the referrals. Maybe they're still just playing it by the book, right? They know the traditional, I guess I'll say, starting point. Like, hey, I go to this clinic. You and I both know what they're going to get prescribed. It's going to be 200 milligrams of testosterone cypionate. Hey, do 3 injections per week. You're probably going to need an anastrozole because we got to keep that in check. I may or may not feel great for the first couple of weeks or so, and then I might start feeling like crap. How does somebody unwind that puzzle or unwind that knot and put together that puzzle that is like, well, they're on testosterone, they should be feeling fine. Like, right, it's testosterone. I gave it to you. You should be great. Your numbers are now fantastic. You feel good, but I still might feel like shit. Like, what happens there? How come for somebody else, testosterone feels amazing? Someone else is like, dude, I kind of feel the same. If not, I feel worse.
Oh, this is such a good question. I think again, we can go back to, I love using analogies or common, we can think about a diabetic. All right, Andrew, I hand you an apple. I have an apple. It's the same size, same type of apple. Hey, Andrew, I want you to eat this whole apple with me in 3 minutes. We're going to prick our fingers and check our blood sugar. 15 minutes later, what's our blood sugar? 30 minutes later, what's our blood sugar? Are they the same? Largely, probably not. Okay, now we need insulin. Well, how much insulin do I give Andrew? How much insulin do I give Nico? I have no idea. Why don't we start somewhere here? Okay, that didn't seem to work. Or Andrew feels amazing at 12 units, but Nico feels awful, and we've given him 20. All of a sudden, again, I think this is what freaks a lot of providers out, is hormone replacement therapy is not a one-to-one with our own endogenous hormone production. And so to kind of try to break that down a little bit, for example, as men, if we're really healthy and robust, which most of us aren't, we should be making about 70 milligrams of testosterone per week.
Okay.
From our testicles, okay. So, however, ironically, if we go to testosterone replacement therapy, all of a sudden, if we give men 70 milligrams of testosterone per week, the vast majority of them are going to feel horrible. Mm-hmm. It's not enough to replace what somehow their endogenous production was able to do.
Okay, so then is it akin to, like, if I go outside and I get natural sunlight, my vitamin D levels might still not be as high as if I were to just take a capsule?
That's Absolutely correct. Yeah. So, and that's the confusing part. We don't have, like, if people ask me, like, well, why is that? I don't know. We can, like, talk about androgen receptor activity levels and do you have androgen resistance and blah, blah. We could go on and on and on. We don't know for sure. But what gets to the heart of it is we have become so ingrained to do algorithmic medicine. Who is Andrew? Andrew is this tall and this big. Okay, great. 200 milligrams of testosterone, once weekly injection, 1.5 milligrams of Nastrol, blah, 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 blah. And we treat everybody the same. That could be 5'4" Nico, that could be 10'5", blah. It doesn't matter. Everybody gets the same dose, and then it's no wonder everybody doesn't feel the same. You're going to have a bell curve. Some people feel great, some people feel terrible, other people feel amazing. I think when you get into hormone replacement therapy, you have to now become like an artist. And I say that, and it sounds kind of goofy, but, like, I mean that. Like, there's the art of medicine, which is there's so much nuance, there's so much creativity that has to be involved. Because you have to understand the person you're dealing with. You have to listen to their symptoms. You have to look at the numbers, and we have to use that as a guide, but not treat that like dogma, right? And once we kind of get away from that, then we end up with these really, really amazing outcomes. So I think when something like HRT University came around, and many other courses too, again, I think so many providers are like, just give me the protocol, just give me the algorithm. And again, I tell them that there are guidelines, but if you want to think in that way, it's going to be very difficult to be successful in this niche, because that's not where this niche is going. You really want to have fun with this. And so, like, it's funny, like, I grew up homeschooled, so I always talk about, like, the love to learn, right? A lot of times you go to school and it's miserable, right? And you just sit through these horrible classes and teachers who are not engaged, and they might be teaching you really cool things, but it's not interesting in the way they're presenting it. Or maybe the environment that you're in.
Yeah, you're forced to be there.
You're forced. So I always want to take HRT because, again, it can feel so sterile and boring and, a lot of biochemistry and all that stuff. And take it and say, wait a second, let's understand why we're doing this. What's so powerful about, why would I give someone HRT or TRT? And it's way more than just like, well, their wiener doesn't work. That's cool. But, like, what about if it makes them a better man, and it makes them a better husband, and in turn that makes them better fathers, and that in turn that makes their kids more well behaved, and those kids then go out, right? We can start seeing this huge ripple effect. And so I always want providers to know what you're doing is way bigger than you could possibly imagine. And if you learn to love it and have fun with it and enjoy it, and you see it as something that's beautiful and interesting, then all of a sudden it feels like you're way beyond just medicine. Now it's something really, like, personal.
Yeah. So you did mention, like, looking at numbers, and so I'm assuming you mean blood work and where these markers land. What are some things that people are overlooking? Because, again, like, me from the outside looking in, like, first thing I go to on anyone's labs that they show me, I'm like, where's your test and your estrogen? Like, where are those levels at? Obviously, I'm definitely not a clinician, but for those that are, like, they're probably overlooking something, I'm assuming, in favor of the big movers, that, right? Like, okay, my testosterone's X, or my client's testosterone is X, and we want to get it to Y. Cool, it's at Y, but hey, bro, you forgot about Z, right? So what are some of those markers that people are overlooking?
To speak specifically to men's health, and I don't know how much time we have because I could talk about this forever.
People need to hear this, man. So, like, I would say distill as much as you would like to really convey the message and get the knowledge across.
Okay, I think one of the classic examples is most guys, if they go to, say, even a primary care, and somehow their primary care begrudgingly gets a total testosterone for them. So if you're a patient and you say, I want my testosterone levels checked, you're 99.9% of the time, your provider is going to check a total testosterone, which is, in a lot of ways, saying, well, how much gas do you have in the tank of your car? Is it a full tank, or is it half a tank? Is it a quarter tank? We'll see. Let's say, Andrew, you go to your doc and you ask for this test, and your total testosterone level comes back and it's 964, which is above the reference range. It's really high.
That's now above?
Believe it or not, that's now above, which we can get into that too. But so your levels come back high. Yeah. Your levels come back high, but you say, doc, my wiener doesn't work. I'm tired. I'm fatigued. I'm kind of down on my luck. I have no motivation. I have just this kind of lack of joy. I'm sore all the time. I'm getting sick all the time. I feel like something's wrong. And they say, well, Andrew, I don't know what to tell you. Your testosterone level's fine. You must be depressed. Take this antidepressant. That's usually where the buck stops. if you were to understand testosterone replacement therapy in its fullest, and hormones in general, you would know that checking a total testosterone level is just checking a variable. How much gas do you have in the tank of your car? Well, here's another question. How much gas is in the engine so when you turn the key over, it starts? Right? So, I mean, okay, that's a totally different question. If I say, Andrew, how much gas do you have in the tank of your car? Well, it's full. Well, does the car start? Well, no. Okay, well, we need to check the engine now. So I check the engine, and we would call that free testosterone. How much of all the testosterone you have in your body right this moment, how much of it is actually available for you to use? It's free. It goes up to the cells, touches them, and starts the cascade of all the positive things that testosterone could do. So, okay, the logic is, well, wait a second. So I have a full tank of gas. It should be good, but my car's not starting. Why then is my free testosterone? What's going on there? So let's check a free testosterone. And your free testosterone comes back at 6, and the reference range is 7 to 20. Well, wait a second, Nico. It doesn't make any sense. I have a full tank of gas. So how in the world is it possible that my free testosterone is so low? It's not making it to the engine. What's going on? The other, if there are, again, 3 labs that maybe you could look at, the third would be sex hormone binding globulin. We call that SHBG for short. And if you envision sex hormone binding globulin, something we make every single day, we make millions and millions of them. They're proteins, globulins, that bind to sex hormones. And SHBG has a love affair with testosterone. It binds very, very readily to it. Well, let's say your sex hormone binding globulin level, let's just say the range is 20 to 45. But your SHBG came back and it's 105. Way higher than the reference range. So you have all these binding globulins, little Pac-Men that are floating around your bloodstream and gobbling up all your testosterone. So you have plenty of gas in the tank, but it's being held hostage by this SHBG, so you can't get enough free testosterone. Now, again, there are multiple reasons why that could happen, but let's just focus on the fact that that is why you feel like crap. You have plenty of gas in the tank of your car, you just can't use any of it.
It's almost like the gas is in the trunk. It's not actually in the tank, right? Like, oh, I got hella gas, but like it's not in the right spot.
It's not in the right place. It's not usable, and ergo, you're going to feel like crap.
Yeah. So then, kind of going back to the like, who is HRT for? When it comes to testosterone, again, we have this idea that, all right, if you're 35 and below, like, dude, you got to get the sunlight, eat red meat, sleep, work out, train hard, feel terrible, but keep banging your head against that brick wall because you're not old enough, and you should be able to figure this out on your own. You're not old enough for testosterone replacement therapy. Like, what are your thoughts on that? Like who is TRT for?
Right. So again, in general, testosterone replacement therapy should be for everybody. There was probably a point in time in history where that probably wasn't as true as it is today. You know, what I was talking about stage earlier today is this fact that men have lost about 50% of their total testosterone levels since the 70s or 80s. The reference range even then was probably very different. The upper quartile, we call it, of total testosterone was probably almost double what it is today.
And what is it today? Because I thought it was over like 1,200 or so.
No, well, it will depend a little bit on where you get your blood work done.
Okay.
So every lab has a slightly different reference range. In general, most labs today, I would say the upper quartile of total testosterone would be somewhere between 900 and 1,000.
Okay.
So it's quite low.
That's still low.
It's quite low. Yeah. And again, the lower end is, it used to be 400 and then 300, and now I've seen as low as 200.
Yeah. I remember, like, when I got my labs done, this was probably about 8 years ago. I remember, I think the reference range was like 250, and I was 251.
Amazing. Right.
The
doc said you're good.
Sick. Yeah, the doc, hey, no, well, it wasn't so much the doc. It was because I just went through like private MD labs, and I just remember like so many red things popped up, and that one was not a red flag. And I'm like, hey, man, if all of these, this is the red flag, right?
Yeah. Something's going on here.
Yeah. So we got a little sidetracked there, but like what I was asking you was like, who is TRT for?
So I think testosterone replacement therapy is seriously for any male who medically requires it. And again, I think the frustrating part with that is it's quite subjective in a lot of ways. I think it can be, this day and age, very difficult to know who that is unless you, again, really understand the depths of hormones and you understand the depths of looking at blood chemistry and serum labs and all that sorts of stuff, and really being able to kind of pick apart different variables to kind of end up with okay, this seems to be the problem and this is clearly the solution. And so I think testosterone replacement therapy, frankly, I know of teenagers who could use it, kind of thing. And I think it feels so strange to think about a 17-year-old on testosterone replacement therapy. Meanwhile, we give young women birth control all day long without a thought. I mean, we dole it out like candy. So there's a lot of double standards that occur. There's this idea that testosterone is sterilizing, that it will destroy a young man's testicles and he'll never be able to have kids, and he'll never be able to produce his own testosterone again, which he produces none anyways, essentially, because that's why he's getting it. But the truth is that testosterone replacement therapy is not a permanent thing, so to speak. It's not something you take, and if you stop taking it, you keel over and die in a 3-week period, right? Like you will continue to live your life, and in fact, you'll go right back to baseline. The problem is you go back to the baseline before you start, where you started, right? Which is not good, and most guys feel worse, right? I always say, like, if you take testosterone replacement therapy, it feels like you got handed keys to a Ferrari, and you're living large. Imagine if 3 months later I said, "Hey, dude, here's that beater Camry from 1998. Have fun." And you would just, even though that was the car you started driving, it's not the same anymore,
No.
right? So. But again, testosterone replacement therapy should be for anybody who medically requires it, straight up. Just like we would give insulin to a diabetic who medically requires it, why would we withhold something so valuable from men who need it?
Yeah. So a patient has an awesome clinician. They get prescribed testosterone and they feel fantastic for about 3 months. And then all of a sudden it's like, man, like I'm like not as horny as I was like a couple of weeks ago, and like my just overall drive just doesn't feel quite as amped up as it was like a month ago. Like I want that again. What happens there? Like where does that go?
So there's a lot of variables that could be going on there. Again, broadly speaking, usually when that occurs, so imagine when you're first starting testosterone replacement therapy, your poor testicles, they're not producing much testosterone, but they're producing some. They will continue to produce that little bit of testosterone in addition to now the testosterone you are being prescribed. So there's a little bit of like let's call it a doubling effect, where you've got this like, wow, oh my gosh, like I've got all this testosterone. About 3 months in, which is essentially about, let's say, 8 weeks, is when your natural production of testosterone from your testicles shuts down.
Wow.
So again, you were taking, you were producing this much, very little. Now you're taking testosterone and still producing, so you're getting a lot. Let's go. Right. And now all of a sudden you stop producing your own and it comes down a little bit, levels out. So most guys at that point then just need a dose adjustment. Typically an increase.
Okay. So it is as simple as that, because that's like in my head, I was going to kind of try to lob that one and be like, okay, so the answer is just take more, but it actually...
It could be. Here's another truth. Some guys are, they experience a honeymoon effect.
Oh, 100%.
Right?
Yeah.
You get this 2-3 week period of like, gosh, my brain's on fire.
I warn all my friends, I'm like, hey, dude, talk to your wife, because it's...
And so here's the classic psychology is, as guys, we love that feeling. We can't get enough of it. Your wives hate it. They're usually calling me saying, you got to take Andrew's levels down a little bit. I tell most of my guys, I warn them, first of all, because it's important to know. Like, you warn your friends, hey, realize this. There's a period, it's a honeymoon effect. You've not felt this good ever. You've got kind of this doubling effect. It's not going to last forever. No one wants to have sex with you 3 times a day. That's unsustainable for you, even as a human being. And let alone, that's not what this is intended for. The goal is not, let me have libido of a 15-year-old moron. Let me have healthy libido. And live a very high-quality life. There's this idea that people, men like to chase the unicorn or the dragon around a lot, right? And like, at some point I'm going to feel better. And sometimes it's just like, hey, man, you are feeling better, right? Your relationships are better, your blood pressure's better, your weight's down. Things are good. Relax. Enjoy it.
You can go two ways, right? You can be Paul Saladino. You can take your shirt off in a supermarket and you could just spew lies for attention. Don't be Paul. Don't be Gary. Don't be Lane. A lot of these guys, they just throw up this clickbait.
We're all trying to help people. What gives you the right to talk about what they're doing?
They're not helping.